Thank you for joining Reading Horizons today for our expert panel discussion on dyslexia screening. We are fortunate to have Chantel Barrett and Donnell Pons sharing their expertise on this important and timely topic. Chantel Thaxton Barrett is the lead professional development and dyslexia specialist for Reading Horizons. She has a BA in English teaching and an MA in education with a reading science concentration and dyslexia certification. She is trained in letters, SERI, and both basic and advanced training certification in Orton-Gillingham. Using her experience as an English teacher, reading dyslexia tutor, and mother of a child with dyslexia and dysgraphia, Chantel provides consulting support for schools across the nation and is a featured speaker at dyslexia conferences where she can share her passion for raising awareness about the importance of effective reading instruction for every student, especially for individuals with dyslexia. Donnell Pons is a reading and dyslexia specialist in Salt Lake City, Utah. Donnell started her career in education when her youngest son was diagnosed with dyslexia, going on to receive dual master's degrees in education and teaching with a certification in special education. She is also a tutor in several Orton-Gillingham-based reading programs and is a certified dyslexia screener and consultant. Pons has served as a teacher and literacy coordinator, authored articles, presented webcasts, and conducted workshops on dyslexia. Thank you both for being here.
Thank you.
Our discussion today will include questions that were submitted by those who pre-registered for today's webcast. So, our first question. So what is dyslexia screening and how is screening different from assessment or testing? So Donna, let's start with you.
Yeah, it's an excellent question. The screening process obviously is much less rigorous than you would do for an assessment or testing. The other thing is within schools, and I'm not sure where they are across the country, but it's certainly in our state here in Utah, we have rules regarding who can diagnose. So who's actually doing an assessment that leads to a diagnosis. That's heavily regulated, and it is in most states. Within the schools, though, when we're looking at screening, what we're talking about is just looking for red flags that there may be an issue with learning how to read with this student. And so screening is a lot less rigorous, as I said, and therefore a school can often take on that role of screening for dyslexia. But then again, it becomes tricky because what are you allowed to say in a school in terms of, I think your student might have dyslexia? You need to be careful with the wording of what you say. And that, of course, is by state and what the regulations are. But being versed in that is obviously part of our job. We're not allowed anymore to say, well, because I don't know, I'm not going to say anything. We have struggling readers in our classroom and we have to do something about it. And that's why we're trying to gather all this information and disseminate it to teachers to help them know what to do about it.
So this is a more informal way of gathering information, data, that then can be used to help identify if there should be something more.
Yes, and in fact, it might be much easier to call them struggling readers or readers potentially to struggle with reading, right?
Okay.
And so if we say screening, don't be nervous that, well, I know nothing about dyslexia, my school doesn't support me in the cause of dyslexia. Don't worry about that. You can call this struggling readers, right? Because that's what we're looking for.
Great. As we mentioned, many states have included universal screening as a component of dyslexia legislation. What are the goals of universal screening and how is universal screening best accomplished? I'm going to ask that of you again, Donnell.
Yeah, so the goal of universal screening, wouldn't it be awesome if every school in every district across the country were screening for reading difficulties and every child who arrived at the first of the year was screened, right, for reading difficulties? Then we would have at least a handle on how to improve reading outcomes in this country. That isn't how it is, though, and it's hit and miss as to where your child goes to school. However, one thing that isn't hit and miss is every school is taking data. That's required, either at the district level and also at the state level, right, and beyond. So we know that data is being taken. Now, what's being done with the data? So if you aren't receiving data as a parent, you don't understand where your student is as a reader, you're going to ask for that reading data that's taken. Certainly K through 3 has very specific reading data they're taking, but also beyond 4 and above, 4th grade and above, there's data still being taken and assessments on reading. As a parent, ask the right questions. I want to see that data. I want to understand what it means for my student.
So is this similar, or could this be similar to the way schools do screening for eye, vision, and
Absolutely.
hearing? We're looking at our population of students to identify early who might be struggling with a characteristic we want to look at further.
Absolutely, and the most important skill, reading, we absolutely should be doing universal screening.
And I think part of it is, for so long it was just reading tests were based on a comprehension thing. And
Right.
students in those younger grades especially can memorize, like my son, for example, and they look fine. And so they would go until it was really at that critical point before anything was even identified, that 3rd, 4th grade level. And the beauty of screening is looking for specific factors that don't always get identified in just, like a a universal just reading assessment. And so I think that's critical because we weren't looking for the right things initially, and that makes a huge difference. I know like in the states that I worked with that are mandating that, is that finally then they're looking at the specific things that we need to so they can get the instruction earlier rather than later.
Yeah. And that really leads to that next question, which is that you both have children with dyslexia, and universal screening wasn't in place in the early years for your children. So can you reflect on rather universal screening, how it would have made a difference maybe for both of your kids?
I think understanding what you were looking at. So as you say, when you got a reading assessment, I'll take DIBELS for example, because it's a very commonly used reading assessment. If you don't drill down on the data in a DIBELS, you could easily not know what you were seeing, if a student was really struggling or not. But drilling down on the data that it's collecting about phonemic awareness, about being able to manipulate sounds. You're gathering that information, but oftentimes we're not looking beyond just a basic score on that testing. And so that's very helpful to understand that I should look beyond just the initial score, because there is information that could be provided. The other piece about universal screening, I was astounded that my husband, who had been through the school system 30 years prior to my child with dyslexia, had the very same experience as my son 30 years later. We all should be appalled, right? That should not happen. And so was data being gathered on my husband? Oh yeah, data was being gathered on him too. And that was back in the 60s. Nothing was being done with the data. And we know that data was gathered as early as the 30s. We were having a conversation earlier about how in the 1930s they were gathering data about who might struggle to read, just not doing anything with the data.
So how would that maybe have made a difference with your son if there had been universal screening right from the beginning? Huge
difference, because early on he showed markers of someone who was going to struggle with reading. Very bright, obviously, all children are, but he was also showing weaknesses in certain areas that were directly related to reading, right? And that should have been caught and made aware of it.
And Chantel, what about your experience?
Well, I think what comes along with that universal screening is the continued education for educators of knowing what to look for and what to do with, because even when I was able to identify it, he was between first and second grade, so I was catching it early. The school wasn't catching it, but then when I went to try to get those things that I needed, there was still some disconnect on what they understood, and there was still the return answer of it's developmental. He'll get there. And so I think that's the thing, is that it has to be twofold. There has to be the screening, but there has to be the education at the same time, or no one knows what to do with the data from the screening. So I think it's almost been one of those cart before the horse things, where it's like we've had to get enough more awareness brought in for us to even recognize the need for screening, what to do with it when we have it. And I think they're kind of both coming up a little bit. So yeah, I mean, like I said, yes, it would have been great for the school to identify it, but I did identify it early. But then it still wasn't, what do we do with it from the school standpoint? So it has to be both.
Yeah. And that really does kind of get to this next whole component, which this question comes from Tina in California. What things should a teacher look for in a student who may have dyslexia? So if parents may be coming to educators and saying, oh, I'm seeing this, and the educators aren't sure, or conversely, educators who are seeing some things in the classroom talk to a parent who maybe isn't aware either. So what should teachers look for?
Chantel brought up an excellent point about we may get very good at talking about how to screen and what to use to measure a screener, but then when you end up in the classroom with a teacher who has your child who's struggling with reading and they don't have an intervention or don't understand how to appropriately address the need of the student, you're stuck. You're still stuck. And so this is an excellent question about if a teacher looks and sees that this student may have dyslexia, to me the next question is very much, then what? Right? So if you can identify the student who has dyslexia in your classroom, and that looks different at different ages. So we have, if you're anywhere from K through 12 in a school setting, then those things that earmark for dyslexia could look different, and they look different in students. This is one of the challenges. It's a variability thing. The challenges that student may have could be different given their strengths and weaknesses, right?
Yeah, and we are going to definitely address some of those indicators specifically. Research shows that a number of indicators do occur early, even before a child starts school. So in most cases, only a parent or caregiver would have that information. And what are some of those early predictors? Yeah. Something that a parent would know, maybe even before they start school, that we should be asking.
I think this is a great question too, and it leads to, in the state of Utah, we're working on a dyslexia task force, a manual. Task force has been put together to look at putting together a dyslexia manual for our state. The manual is to be used with teachers, parents, administrators. It's for everyone to be involved because, as you say, oftentimes parents bring a great piece to this. I was a wealth of information for my son's teacher about what I saw happening at home because, trust me, reading was important in my house. I'd been doing all those things you say you're supposed to do, read with your child, read to your child. going over the alphabet, none of it was sticking. And that was good information to hand over to the teacher, that look, we've been after these things, I've been doing them, they're just not sticking. And I'd had it happen prior with another of my children who had a mild case of dyslexia, and that would have been helpful information. Have you seen this before? Yes, I have, with another child.
Well, and let's talk about that genetic component, because one of the biggest indicators and one of the things we really need to be asking of parents is there a family history? Does somebody in the family already have reading and learning problems?
Yes.
Because it turns out, research shows that's a strong indicator. So.
Now, Laura, what's interesting about that, I've often heard from educators who are a little leery of asking that question, saying, well, I think it's a sensitive question to ask a parent. Has anyone struggled with reading? I have never found as an educator a parent who's honestly concerned about their student learning to read ever hedge on that question. They always think really hard. They try to be thoughtful and say, well, I think, and they want to be helpful. They want their student to learn.
And I think sometimes that's a powerful piece for them, because I can't tell you the countless number of trainings that I've done or parent nights where the parent has come up or a teacher's come up and said, oh my goodness, I think I might have this, because no one has even, to all of a sudden have that conversation, because it's such an empowering piece of information, because so often, especially, those that went through education 20 plus years ago, 30 plus years ago, there was such a stigma with it. There's such an incorrect belief that it's tied to our capabilities, our intelligence.
Lazy.
Yes, or lazy. And that's one of the things that, a teacher said with my son in junior high. I remember that very specifically. He was taking notes, and this teacher was using a PowerPoint, and he was just going 100 miles an hour. And Tyler would try to stay up with note taking, and he'd put his head down on the desk. And about 3 or 4 slides in, because he was just completely frustrated, he didn't want to disrupt the class. And so when I met with that teacher, his response was, well, he's just lazy. I mean, he's just putting and it looks like that, right? Mm-hmm. So we think it looks like a duck, it quacks like a duck, it must be a duck. But that's the thing about dyslexia, is it can look like a lot of things, which that it's not that, which is, one of the things that it looks like, and it's correlated with it. I mean, Dr. Sally Shaywitz talks about it, and they did a study with it, with the correlation between dyslexia and ADD, but the attention being very specific to the reading task and those language components. And so my son was actually diagnosed very early in preschool with ADD. But we didn't make the connection to because I'm like, but he can sit for hours on certain things, right? But when it came to the reading tasks or those things, that's where it showed up. And so all of that information, I had no idea would be tied to reading issues, right? But that's helpful. And I think that's why that discussion with parents and helping raise parents' awareness, just giving my son simple directions, asking him to do 3 or 4 things at once, go to your room, make your bed, pick up your toys, hang up your clothes, and this deer in headlights look, and then this frustration from him. Because the sequential processing is an issue, and I give him more than one step that's verbal, he can't retain it. He can't then turn around and do it. And so there were things that just at our home, behaviorally, getting that information changed what our environment was at home. It wasn't just about the reading piece, like allowing me to have more patience with him and things like that I think was invaluable as a parent.
And think how valuable that would be for teachers who have to give multi-step directions.
Yes.
We're going to work on this, then you're going to turn that in and start on this. And for some students, that's overwhelming.
Absolutely.
And how empowering that would be for teachers to recognize when I'm starting to see that's an indicator that something's going on, that I maybe need to look at. Well, and it's not just genetic components. What are the other things that parents would have seen? For example, students who speak late. After 18 months, a delayed, onset of speech, or prolonged baby talk. There's so many other indicators that we'll mention that really parents would have known. Issues with direction, because that's an executive functioning piece, and so many of and processing. How students process language. And so isn't it important then that we include parents? When we talk about universal screening, almost always we're talking about what the school will do to this whole group or entire classroom of students. We don't often talk enough about maybe the importance of making sure that parents are part of that process.
Well, and I think it's interesting. I felt even in my own experience, and maybe you can echo this, that it's almost like sometimes it's us against them.
Yeah.
And that's so sad.
Unfortunate.
It's unfortunate, and I don't know where that comes from, and the energy of that is different depending on the location, and I think it's so important that anytime we come together as a team and work collaboratively that we're going to get, the results that we're looking for. And so I think it's that idea of supporting each other and not pointing fingers and blaming, well, why didn't you see this, or why aren't you doing this? And I think sometimes parents, we come in very defensively and very accusatory.
Yeah. And they've been through a lot as parents.
Right. And so there's there's a lot of reasons, but we all need to be mindful about how we're showing up.
Yeah.
That we're showing up with a lot of grace, and let's work on this, and can we grow together? And hopefully if everyone's in a growth mindset, then I think we get there. But if we come in any other angle, then I've seen that happen where I've had teachers that I've tried to talk to about my son just shut down. I don't agree with what you're doing, and I'm going to do it this way. And so definitely that's where you run into real issues.
Yeah. And don't you think that ties back to they just don't know?
Right.
And it's not just reading. It's kids on the autism spectrum.
Right.
It's kids with processing issues. I mean,
there's a lot.
There's a lot. And teachers, we all know, we're all educators. There is so much happening in the classroom and so many demands on teachers. And part of the legislation in many states has really focused on making sure that teachers get the training. Mm-hmm. It's not just universal screening, it's also that they get training so they know what to look for.
Well, and can you imagine as an educator, you find out that the number one reason a child will struggle with reading you were never taught how to deal with?
Right.
And that does not feel very good as an educator.
Right.
Yeah.
So let's talk about when to screen. So Marty in Georgia asked, when is the earliest that students can be screened?
Yeah, I like that question. It's a great one. In a family of people who have dyslexia, early, because you know what you're looking for, and you'll be able to see those signs. And we know even prior, as some educators have said, well, they're not reading yet, how can we? And there are indicators, pre-reading indicators. And that would be sound to symbol. I mean, that was one of the first early indicators with both of my children, is I was drilling alphabet, a few letters, not able to hold on to them at all. Very different from what I experienced with my other children. Even if my other children could only do 2 letters, the children with dyslexia weren't holding on to any of those letters and sounds, which is interesting.
And even before that, it's interesting because when we talk about indicators, they're research-based, and one of the first places that I went was to Dr. Sally Shaywitt's book, Overcoming Dyslexia. I actually, as I was concerned about Tyler, went to the doctor's office with one of my kids at that time and happened to pull a magazine off of the shelf, and it opened to this article that was an excerpt from this book, and she was listing these symptoms. And I was thinking, oh my goodness, this is him. Like all these questions that I had. And so that's when I went and purchased the book and read it and had so many dots get connected for me. Things like, and then indicators based on this research, like he did have chronic ear infections. He spoke late. There was directional confusion. And then we have a history of it, in my family. And so, and just that awareness of those connections started to help me understand what was happening with him, because it was very similar where his older sister, I had prepped, for kindergarten in the same ways that I had done him, and I was seeing very different results, which was very confusing for me. And so I, especially as an educator, I felt like I should know why. And like you said, often we don't get that training as to what to look for. And so that information was powerful as a parent, but as an educator to start to know what to look for was just as empowering for me, on both ends, personally and professionally.
Well, even things like rhyming. Parents may not even recognize that as connected to potentially an indicator of dyslexia, but kids who don't really get rhyming, who don't recognize it and can't produce it. Yeah. Simple things like, nursery rhymes and things like that.
Yeah, and he would have like tip of the tongue syndrome. Like he would also replace words. Like he'd want to say, volcano, and he'd say something kind of along the
tornado.
Same, like tornado. Yes, that example. But he could describe it. Tornado, like the thing that comes out of the top of a mountain, and a lot of that where he would know what he was trying to say, but the word mapped to that was so. And that was just in his verbal speech. As he got a little bit older, there was a lot of that happened too.
Well, and you mentioned not knowing letter names, not holding on to letter names, things that kids would do with like those magnetic letters and things like that. But the sounds, not at all getting, and being able to hold on to the phonemes.
Even those initial animal sounds that you do with every small child.
Right.
Meow was Almy, which is very interesting. I'd never heard that from any of my other children. So just small things like that as a repeated pattern that you start to see, right?
Yeah. Right. So the bottom line is it can be as early as we really start to see those language indicators.
Yeah, absolutely.
So let's talk about some of the indicators of dyslexia that a valid screener would identify. Sherry in Alabama asked this question: what methods for screening would give the best results in determining dyslexia characteristics in K-3? So beyond kindergarten, now we're in print. Students are starting to do all the things they do in first grade. in reading and writing, and then beyond that, what are some of the characteristics that would show up in a 6 and 7-year-old?
You know, I think I'll talk a little bit about what I saw in Tyler first and then what I've seen generally with students. So he just struggled to connect those letters initially, and then putting them together, it was interesting because it was like he would recognize a word sometimes that I was like, holy cow, how did you get that word? And then a few lines later, that same word would appear and he'd act like he'd never seen it before. And then he'd get a phonetically more complex word that just blew me away. And then he'd miss something simple like it. And it was really powerful when I understood what was happening, that they weren't accessing the same parts of the brain to deal with language. They weren't accessing that visual cortex and the language centers in the left hemisphere. And so what he was doing to compensate were parts of the brain that were not designed for that. So it's why he could recognize the word one line. Same word would appear just a few lines later, act like he'd never seen it before, because his ability to identify that word had nothing to do with the word pattern itself. He wasn't looking at the parts, right? He was memorizing words as an entire picture, as an entire neural imprint. And if he didn't have it memorized and stored somewhere to be able to recall, which a lot of times the recall was based on, you know, proximity to picture, words around it, which is where we get that idea, you know, that picture cueing is a valid thing for reading. You know, that's not decoding, that's guessing. Same with first sound. You know, I get that that's a part of it, but what that really does is it creates a strategy to guess. And I don't know where that's become a strategy to guess. There's nothing empowering about that, right? Does it need to be there as a resource, maybe as a backup? Yes, but it shouldn't be plan A, right? And that's what I would see, is he was exhibiting all these things that were really survival. Guessing, skipping, looking at the picture. There was no decoding happening. His reading was choppy, and I see this with students all the time. It was choppy, would skip around. You know, just all of those things were things that I saw in him and then was able to recognize in students later about that same age, between like 1st and 3rd grade.
Well, and we know that, you know, dyslexia is not connected to intelligence, that most students with dyslexia have average or above average intelligence. So, you know, usually these students have adequate verbal skills. The problem is when we start seeing it connected to print. So they can understand something read to them. K to 3, they have great little auditory memory sometimes, and that's what you know earlier we mentioned. Sometimes teachers miss those because they look like they're making progress. And so in the earlier grades, you know, having difficulty memorizing those sight words, where other students are getting those very easily. Or just students who are 6 and 7 years old who are learning to read, and everyone's excited to learn to read, except those students are saying they hate to read. They're avoiding it. Doing anything they can to not read, and especially read out loud. So those indicators certainly are present if we know what to look for.
And that can even show up when you talk about them hating to read. A lot of times it's so laborious, and there's so many things tied to that. And you get the anxiety going on that it manifests in physical symptoms like headaches, stomach aches, and that really did with my son. Like I recognized, you know, I knew there was a problem, and I was kind of just dipping my feet into it. And what pushed me into moving quickly is when his symptoms became so loud. He started throwing up every day before 2nd grade. He was terrified because there was popcorn reading happening. He didn't know when he was going to get called on. You know, so it can manifest physically that you don't always know, why is he getting headaches or why is she getting headaches? And really it's because of what they're having to, you know, what's going on cognitively for them is really, really challenging.
And even behaviorally. I'm going to the bathroom. I'm going to go to the nurse's office. Anything to avoid, you know, having to read in front of their peers, or the anxiety.
The behavior that we call class clown manifests very early for students who are struggling, because they want the attention to be taken off of their struggles academically. And so they're willing to be that clown. They're willing to be the student who's always in trouble. And the other thing I read in Ben Foss's book, the Dyslexia Empowerment Plan, that just rang home for me about my husband and my son both in school, was the overly adventurous kid out on the playground at recess, who was willing to do all kinds of daring do to make sure everybody thought, oh, he's awesome on the playground because you don't want to look at me in the classroom. And my son was doing all of those behaviors, and being able to put it all together was very important.
Right.
Yeah.
Well, and so methods for screening. When we talk about screening, what are we talking about? There needs to be a screener, right? And so let's talk a little bit about that. So what is available for schools to use, and what is the best way to screen students universally?
There's as much a variety in screening as there is in everything else. And with the lack of information about exactly what we're doing, one of my the biggest things that I would do as an educator is make sure you understand what your local state office of education is doing. So every single state office of education has a K-3 literacy program. And log on, see what it is. If you haven't been to the website, please visit the website as an educator, because you need to know what it is your state office of education is mandating. What are the tests that we're giving to students and why? What is the data telling us? There's a lot of information available just at that website alone. That's why as we come along on this adventure together, where we're finally grasping the information that's been given to us, now what are we going to do about it? We are going to have to involve everyone. All of us have to be together on this. So teachers in their classrooms have to be connected to their district offices and their state offices of education. Everybody's got to have an understanding. If pieces of information are missing for you at that state office, then you ask for those pieces of information. You're going through your administrator at your building too. Ideally, you should be working with an administrator at your building. So I hate to see teachers who feel like, oh, I have to screen by myself in my classroom. I'd really love to see you be part of a community at your school. So if you're really interested in screening, that's where I would start as an educator, is gather other teachers who are interested in screening as well, get the administration on board as well, and then let's start. Do start. And there might be other people within the district who have done screening or are trying screening, connect with them.
Well, and then there's the International Dyslexia Association website, and this book would be great for educators.
So this is Dr. David Kilpatrick. He's taken the last 30 plus years of reading research, and he's put it in this one book, The Essentials of Assessing, Preventing, and Overcoming Reading Difficulties. What I appreciate about this book is he takes you through the entire thing, and he's not assuming that a school has a lot of extra money, and he's not assuming that you have a great infrastructure for being able to remediate with reading, and so he starts from the basics. What do I do today if my school has struggling readers, which every school does? Where can I start? That's what I like about this book. And his screening is very simple. It's rather simple. You just take early indicators of, in those K-3, you're looking at phonemic awareness. And he's also, another key component to it is rapid automatized naming. How well do they do with just naming objects and things? Because we know that processing
Colors,
things.
numbers, letters.
Colors, numbers, letters, yep. And then, so those are the primary indicators that you're starting with. And so he does a good background.
So I think some people may get the impression that, like testing or an assessment, that there has to be something that's more formalized, that you have to pay for a screener, and there are paid screeners out there, or that it has to be normed in some way so that the data is collected in such a way that it's, standardized. Is that accurate? Do we have to have elaborate screening?
As a parent, I would never pay for a screener, because a school isn't going to do anything based on a screener. They're just not. If the school has indicators that your student is struggling, they'll be doing their own testing. So I would caution a parent against paying any money for a screener, just because I don't know how far you're going to get. And typically parents want something for the screener. They want to be able to walk into a school and receive services. And if that's not going to come, I feel badly for a parent who thinks that's what's going to happen off of a screener. Until we have a better idea of what we're doing with the information, with screening that leads to getting services within schools, I think that's where we're at.
Well, and I think too, this is the thing that I hear working in schools all over, is there's this big concern of, oh, now we're screening everybody, now everybody's going to be identified, and then we have to service everybody. And so there's almost this pushback and this fear about it, because it feels like everyone's getting diagnosed with it. That's the here I think almost as a kind of a side, an aside, like, oh, everyone's got it, right?
Right.
And I get that. I think, so the concern is, well, as a screener, just everybody might have some of these symptoms, right? So we're looking for more than just one. We're looking for a consistent pattern of these going on, right? That's important, that we're looking at that carrying through, not just occasionally. But I think, when I've had that argument and we recognize that the type of instruction that these students need is so beneficial for every student, that it's like, and so what? So what if we provide every student with this amazing foundation?
Reading.
What if we empower every teacher with knowing how to teach this? What is the worst thing that can happen? Everyone does better.
Yeah.
And so I think that understanding of, this will not hurt anybody, and it's just empowering and beneficial all the way around. Because I think that might be something that we can look at and help remove some of that fear around.
Yeah.
Well, especially since, NAEP, the National Assessment of Educational Progress scores, show that a majority of our students are not reading proficiently, and that's not necessarily because of dyslexia.
Right.
So really what we're talking about, a screener would really just be an indicator of what do students need, maybe more explicitly, more sequentially, more practice, that kind of thing, to prevent that difficulty later on.
Yeah,
Absolutely.
And in the summer publication of Perspectives magazine by International Dyslexia Association, it's all on screening, the early identification of reading difficulties. What was interesting about this, I thought it was fantastic, is they said where to set your cut points. So if you are worried about everyone's going to be identified, they talk about, okay, let's set a high cut point. What do you do if you have a high number of students who are being indicated as having reading difficulties? Now we're breaking into 2 groups within the classroom. So it shows you how to wrap your head around who might be struggling with reading. If I do get numbers I wasn't anticipating, can I still handle it? And the answer is yes, you can. There are things that you can do to start helping students, and it's rather simple.
Well, and isn't the real goal of universal screening that when you catch kids early, we know that the brain, we can wire the brain in such a way that it will activate those language centers. And the research that has been done shows that when kids get that early intervention, their brains look like those of a good reader. So that it's the problem is waiting. And so the further they go, that wait till they fail kind of situation we've found ourselves in for many years actually causes more of a problem because later on, those teachers have even less understanding of what to do with struggling readers. So for those of us who have worked in middle schools, junior highs, and high schools, then you've got a ninth grader reading on a 3rd grade level, and we have a huge issue.
And if you're struggling as a 3rd grader with phonemic awareness, it looks a lot different than a 9th grader struggling with phonemic awareness, right?
Absolutely.
And those issues are a lot bigger.
And one of those things that's so important as far as that waiting too long is when we use that discrepancy model, to identify that they had to be so far behind. And that was the thing, like my son, I'd worked with him just enough, he wasn't far enough behind to qualify for anything. That's the danger too. And I talk about that a lot, so often mainstream teachers will say, well, I don't need to know that because it'll get picked up by, the tier teacher or the special education teacher. And my son didn't show up in any of those classes, right? And so we do have a responsibility to know that because of that identification. Thankfully, we've moved and are moving away from that discrepancy model, that strengths and weaknesses, as you mentioned, as we were discussing earlier. And that's powerful. That's why that screening becomes so important, because it's looking at those indicators. But yeah, just waiting to see that they're too far behind, especially like my son had a really high visual memory. He wasn't showing behind scores on reading for a while. And so that's just back to what you said about how important that is to identify it early.
And it doesn't show up often until those later grades.
Yeah.
So, and with screening, as opposed to assessment and testing, there's no interview, there's nobody observing a student reading, there's no looking at grades and where they've struggled. So isn't one of the purposes of screening is just to get these basic research based indicators so that we can look at, does the child meet these characteristics? And if so, how many of them?
Right.
If there's 1 or 2, maybe that may be developmental, but if we see a constellation, a pattern, then we can really start making sure that student gets the right intervention.
And it's a great conversation piece to take into the school with you as a parent to start a dialogue. If you haven't been able to get anywhere in terms of, I think my student might be struggling with dyslexia, having done a screener and then being able to bring it in and talk about it, here are the indicators. Because oftentimes, as we know, a teacher has never seen them, doesn't know. And so it's a good place to start. It can be.
And there's, their classrooms have such diversity within them. Kids who come in reading already in kindergarten to kids who don't even have a pencil grip, and everything in between.
Well, and I think Dr. Shaywitz talked a lot about when you're saying what's being looked at. She talked so much about looking at the whole picture. There's so many pieces to that as opposed to just one part. And that includes their strengths. Many have talked about that, and how important it is to look at that. And I think that's particularly important. And I love on the screener that's being developed here, looking at those strengths as well, because that's important conversation to have with the parents. I know for me personally, and I don't know what this was like for you, Donnell, but there was this level of, when I was just getting into the information, almost this grieving of, this is not going to be easy for him. And my dreams of, us reading books together, on the grass in the summer, these big novels together was just going to, not going to be the case for him. And I had to kind of reframe what my story was going to be with my child and allow him his journey. And what a beautiful one it's been, and allow that and the growth that's happened there. But I think sometimes as parents, we go to the negatives of it very quickly. And as teachers, we kind of have to, because that's where we need to remediate, right, and provide that accommodation. But I think it is important to look at their strengths and guide parents as much in that and celebrating that, and also finding ways to do that. Get them involved in things that are doing, crossing the midline, whether that's dance or karate or sports, or that they can excel at. I remember, my son even saying, there was a time where he was really into video games and I had all my qualms about that and trying to get him off. And he said, when I was talking to him about it one day, he said, Mom, in this world, I have no limitation. I'm as good as everybody out there. And that was really powerful for me to get that. There were places where he needed to feel that. He needed to feel like I can do this and confident there. Because then that went into everything else. Just if we don't give them places to excel and build their confidence, then I think it's a little bit, it's just not even a little bit, a lot harder journey for them.
Which is what which refers to in the Seas of Strengths, these islands of competencies that we want to make sure that our kids are being able to explore and excel at. Yeah. And that's actually a characteristic for older students. That does the child have strengths in areas that are not print-based, like critical thinking, like verbal reasoning, like math or science or art or, both of your children have excelled in areas that are not at all connected to print, but just above average and exceptional in things that they can create and design.
I think, one of the things that was important for me as an educator to remember and as a parent is that with dyslexia, not like other things, it's unlike other things in that you're not going to see typically in your day-to-day life of this individual out just being them and interacting with people, you're not going to see dyslexia. Not really. But the minute they hit the classroom, that's when we really start to see dyslexia. So to take the teacher away from having to be a part of this dialogue about dyslexia and not make it part of what you do in schools is completely wrong. I mean, it's as indicating to say to somebody, I have a specialist for you that's in this building, but they're not going to be trained in anything that has to do with this specialty at all. But please come to the building and receive services. That's essentially what we told to people, is this issue with dyslexia, you really will not see. It's language-based. And so everything that we do in the classroom is directly affected by dyslexia. My husband, outside of the classroom, looked like a rock star. You wouldn't have known he was going to struggle in school. The minute he hit the classroom is where things got hard for him. So I think that's another thing to keep in perspective as well. And then this thing about strengths, I think is awesome. And I think it is good a reminder to teachers and educators. We're not very good at finding ways for kids to excel differently in a classroom. And I'm not just talking about dyslexia, but in other ways as well. We know we struggle with that. Trying to open that door just a little bit wider for people to have an experience in the classroom where they feel good about themselves.
Well, in fact, I'm sure we've all had the experience where parents have actually pulled kids from sports and things like that because they weren't doing well in school, because they were struggling, and they use it almost as a punishment with the intention, the best of intentions, which is we need you to focus more on this because it's so important, but that's what those kids really need.
Yeah, right, because everything in their day will be focused on the thing that's hardest for them.
Right.
Yeah.
Right.
Absolutely.
Julie in Iowa submitted this question: what screenings and assessments can help diagnose students? And we've talked a lot about that, but I think we need to clarify that screeners don't diagnose.
No.
And schools don't typically diagnose dyslexia. That's not a term that schools, and even with the legislation in most states, are allowed to do. So what they would typically do is go through the process that they've used before, which is a specific learning disability in reading. So does it really matter what we call it? Does it matter if we call it an SLD or if we call it dyslexia, if we're screening for the characteristics and we know what to do when we find them? Does it matter?
Well, that's what Kilpatrick, he cuts through all of that chat and discussion about, well, if we don't call it dyslexia, and just says, let's just get down to helping kids. So there is that frame of mind where, you know what, I don't care if you want to have a discussion about what you want to call it. Students are struggling to read. Let's just get in there, figure out how we can help them. And we have the information to do that. So there's that school of thought. But then you also have parents who know that having a diagnosis and getting that name provides a lot of resources. And so there's this ongoing conflict, and I can see it. I'm a parent myself, I'm struggling with it. And particularly as your child ages through the educational system, and now they're headed to college where it's high stakes, if you have not had a so-called label or a diagnosis, getting a lot of the services can be challenging, and they really need them and want them to excel and to have a level playing field at the higher stakes.
But parents just may need to realize that the school may not label it as a diagnosis in dyslexia, but it doesn't matter if they have a 504 plan or if they've had testing to indicate a specific learning disability.
As long as those needs are being met. I mean, I see the argument, but I know sometimes the costs to go get an outside diagnosis
is huge.
And not every, and so then parents feel really at a loss of like, oh, well then can I do anything, right? If I can't go get this official diagnosis, this medical diagnosis, absolutely. You know, yes, you're going to be able to get more targeted. It's just you're going to kind of cut through the tape if you've got the actual diagnosis. But, you know, I've also seen it happen, and even with my son on some levels, is they got the screening, actually didn't have the screening because it wasn't there yet, but just the assessment that said he's got, you know, the specific language disability, and then that was being remediated and accommodated, then he's had what he has needed, you know, along the way, because it is a balance of that accommodation or mediation. One of the things I remember when I was sitting at that International Dyslexia Association conference, it was a few years back, and I went into one when they were talking about applying for college, and I had no idea that this was a thing, that colleges will accept a current 504 plan if it's been in place for at least 2 years or more. If I'm remembering that correctly, it had to be in place because sometimes we don't get it until way late. And I hadn't got it for my son until like junior high. It may have been longer than that. Do you remember if it's 2 or 4 years?
Yeah, so that's one of the things I wanted to address is you don't have to get the diagnosis. I mean, but I'm not going to say to parents, I've had so many conversations across the country with parents, those who really want the diagnosis, and I know why, I understand. And then those who say, I can't afford a diagnosis, and I know why, and I understand. But the one thing that every parent can do, and is very important, collect evidence, collect data. It's all very important. Hang on to it. Hang on to those discussions you've had with teachers, the information they send you back about struggling with reading, the papers that indicated how much they were struggling, anything you can gather. If you have a 504 in place, terrific. If you don't have a 504 in place, have you considered it? Because you don't have to have a diagnosis in order to get one, so it can be oftentimes a lot easier. But have something in place that indicates, yes, indeed, my child has struggled with this language-based challenge, so that when it comes time for the ACT test and you want extended time, you're not scrambling in those precious months before trying to find resources for your student. The other thing is, if I have a student, and I've seen this happen before, and so I think it's important to indicate here, with the older student particularly, that's one I'm kind of passionate about because they get left behind often, is when they are facing an ACT test, I've seen students with a history of language-based learning challenges. However, they didn't end up in special education because they didn't get services there, and maybe they had a 504, but maybe it lapsed, and then they're allowed to take an ACT test and just bomb. And it was so emotionally devastating. They don't want to do it again, yet they need to take it again because the test was done so poorly, and they could get accommodations this time. I never want to see that happen to an older student, but oftentimes it happens because a parent just wasn't aware that really it's going to be that challenging. Yes, it is, because it is a timed reading test.
So let's talk about, you know, what happens after you do a screening. So we do let's say there's a screener, even a universal screen, and we see some indicators with some students. Really, we're talking about general education. What will happen first in the classroom at what we call Tier 1, which is just good instruction, right? Sometimes teachers haven't been trained to just provide that kind of, you know, very explicit sequential instruction that students need. So students often will then move to intervention in Tiers 2 and 3, what we call RTI, response to intervention. And again, the goal there is to get targeted intervention to address what we're seeing on a screener, and then hopefully, depending on how they do there, that's when it would lead next to an assessment or maybe even testing, correct? And Susan in Minnesota asked, does IDEA require dyslexia screening, or is it recommended for schools to do? So IDEA is the Special Education Law, Individuals with Disabilities Education Act, and no, it doesn't require screening at all, because screening is what would have happened early on, correct? I mean, that's something that's more informal, whereas you know, students who have gone through these tiers and have gotten intervention then hopefully would have the battery of tests with all the evidence collected that determines they actually meet the criteria. So does dyslexia screening have really any part in special education?
Within special education, I'm going to go out further and start in every teacher, every educator has something that's called Child Find. You're mandated by Child Find that it's your job, teachers, parents, anyone who works with children and young people, if they're struggling, you're to say something about it. That's Child Find. That's the essentials of Child Find. So should we be screening for reading difficulties everywhere? Yeah, we should. Is it stated? No. Is it within a lot of the wording of a lot of things that teachers do? Yeah, like
Just
Child
like
Find.
Speech.
Just
Same
like
thing
speech.
with, you know, articulation issues and things that we would see with kids sometimes when they're very young.
Yeah.
Okay. Let's talk about some of the challenges of universal screening. And so what are some things that might be prohibitive or would get in the way of, we've kind of made it seem like this is such a great thing and we should be doing it. We know it's valuable. So what stops that happening, do you think?
Well, what's stopping it happening right now? I mean, those same things, yeah. So we have educators who have not received the background that they need in reading to understand what they should be looking for. We have administrators that have probably inherited situations within schools where there was no screening being done and it feels too overwhelming. There's all kinds of layers. That's the challenge. And that's why I think you see a book like Kilpatrick's or others who are saying, let's just start today with what you're doing and start looking for kids who are struggling to read. Otherwise, we're never going to make a dent in the challenge that we have.
Well, and I think time is always the issue. It's like we've already got so many things to do. We've already got so many assessments in place. When am I going to have time to do this? And, you know, that time will get... it's going to show up. Either you're going to end up spending time with that child later on, remediating, or you can do it on the front end and save time later on. You know, time is this thing that it's going to have to get taken care of. And so I think that's the argument, to come back and say, yes, you know, you're going to spend some time on this now, but it is going to save so much time for the child, for those teachers in those upper grades. That to take that time could be the most important thing that we do. You know, it was interesting because I was just conducting a training last week, and again, same thing, teachers full plates, they've got all these other things they've got to teach during the language arts block, and you know, where do I fit this? You know, how do I do this? And I said, you know, in that K1, when they're learning these foundational strategies, that should be your priority. Everything else is secondary. You know, we have to learn to prioritize, and as teachers fight for what's the most important thing, because we can have a million things on our plate, and that's where it starts with us saying, no, my students are not getting what they need if you want me to do 50 things. You know, what is our priority at this grade level or at this student's level? What is our priority? Because too often we try to do too many things and we're not doing any of them well. And I think that's a critical piece that we've got to take into account, you know, is when we're doing that, when we're spending that time. So that always, whether it's the screening or then what after, it's always the thing that I hear back is not enough time. But we can't afford not to. We can't afford not to spend that time on it.
Well, and the other thing is, now that states have passed legislation, often the state then determines what screener is going to be used, and often there's a cost associated with universal screening for every child who takes it, and they're looking for something that may be a little more formalized that does generate data, something that's maybe standardized. So then it again takes it kind of out of the hands of the classroom teacher, or the parent coming to the teacher to explain what they've seen. So is that an issue as well when it really becomes part of legislation?
Yeah, you just mentioned those challenges that can exist, right? When that happens, I think Texas is an interesting example. I don't know if anyone's familiar with their system there, but they do have dyslexia specialists in every school, and they do screening. What I think is interesting about Texas, sure, it's not perfect, and lots of people will say, oh, this isn't quite working how it should. However, one thing they have done is elevated the discussion of dyslexia. It's in schools, parents talk about it, and so I've often had parents who come from Texas as a state and move into a state where there isn't anything being done with dyslexia, and they're horrified because suddenly you're back 10 years, 20, 30 years, and no one knows what you're talking about.
Well, Alabama too. Alabama has done a tremendous amount of work in, you know, screening and really helping train teachers to know what to look for.
It's been a huge shift over the last year and a half, 2 years to see that. In California just adopted.
Yes.
There's a specific to screening.
It is, yeah.
And the idea that those students are provided for in the mainstream classroom, which goes to then the training of every teacher in this awareness and this instruction that's so critical for these students. I think what happens is, I know, especially coming from a secondary background, when you start to hear about phonics and this is what needs to happen for these students, we have to really have that discussion about that not all phonics is created equal.
Right.
There's this sense of, you know, especially in the large basal programs, there's phonics in there, and so it lulls us into this passivity of, oh, we've got it covered. And then we still see the data that it's not getting covered. And so there really is, you know, a difference in the way that we teach it to reach students. That phonics in and of itself is not necessarily effective, that how it gets taught. And I think that's the other piece too, is you know, so often making sure that I know with California, it's like, oh, okay, well now we've got to go ahead and provide that instruction in there. What does that look like? And so I think those are those things that we have to think about too, is you know, what is that next step? And I think that's sometimes a concern with the screening, as much as just getting the screening done, but now what? And how do we do that?
And the quality of the instruction, right?
Well, and even what we call it. There's leveled literacy, there's balanced literacy, there's structured literacy, and even those terms are really confusing to educators as well. So what, in our remaining moments, what would you recommend? What are your solutions for helping to identify students early? Where can we start?
One of my wish would be that every educator had this book. I think you start with good, solid research and evidence. I think this is a good place to start just because this book covers a lot of the research. You might have to find it in different places, but he's brought it all together for you. And that really was the reason behind the book, was it was for educators. And that was one of the main things he had in mind when it was being edited is this approachable for educators? Will they be able to use it? Which I think is great, because he realizes it doesn't matter how much researchers understand about how you teach reading and how best to remediate and how to identify dyslexia unless educators have the same information. And so those really two things need to happen. All the reading research, all that fantastic stuff that we're learning needs to be in the hands of our teachers. It does. And so really when we're talking about screening, it's fantastic, and yes, we will, and we get around to screening, but then I think everything we've talked about today comes back around to our teachers in the classroom. What do they know? What can we get them in order to participate in this as they should? And then that tier one, the general classroom teacher, is so important. Never leave them out. Oftentimes I see us doing screening and we're looking at getting better teaching and understanding methods, and we don't deal with that classroom teacher who's our front line. Really, that tier one educator in the classroom is so important to everything else down the line.
Right.
Yeah.
And I think as parents, I think I've seen both and I've felt both. It can be very overwhelming and feeling like, well, I can't possibly know everything I need to know about this. And I think the first thing is to know you don't need to know everything. I think for me still, when parents ask me, Dr. Sally Shaywood's book is the thing that I say this is a great starting ground. But sometimes we talk about that hereditary issue. Often the parents are struggling so much they can't go pick up this book and read it, right? And so that comes back to also providing family support, as whether those are resources even in our communities, and helping parents know what to do and support them. But that's why those teachers again are so important, because a lot of times those kids get heard that the parents are loud. Mm-hmm. And those sweet kids that maybe don't have a parent able to be loud for whatever reason shouldn't fall through the cracks either. That we have a collective responsibility as a community to help every child get what they need. And so of course that's going to come into, how do we help our educators that are with those students daily to help give them what they need to advocate and provide what those students need.
And Chantel, I thought that was a great point you made about parents and having a place for them to go. Decoding Dyslexia. Every state has one. They're very active, and it's a grassroots movement of parents. I belong to the chapter here in Utah. Can be fantastic because it is that support oftentimes that parents need in order to feel like they're being heard and validated. And you see parents come to that organization at every stage of preparedness, from just learning to accepting to being older and having had kids that went through the system. It's for everyone at every stage to come, get information, meet a community of people who are going through the same thing. So yeah, I'm glad you mentioned
and
that.
lots of free resources online and in other places. So, and we will include a variety of those so people know where to go and sorting through a lot of that information. Thank you both so much for answering these questions. We really appreciate you sharing your expertise. And thanks to everyone for joining us. We hope this has been an informative session.